I'm a therapist, and today I'll be talking about how we can be more confident in social situations, which is kind of ironic coming from me because I'm a pretty shy guy myself. But some of these strategies have been helpful for me as well as the patients I work with. So hopefully you find it helpful too. So, one of my first clinical supervisors in graduate school who specialized in child and adolescent mental health noted that the way to improve confidence and improve your self esteem was to get good at a couple things. And I was like, oh, that kind of made sense because it kind of comes from the idea or the adage of competence breeding confidence. So, by getting good at a couple things, getting evidence that you are indeed competent, then you feel more confident because you have actual evidence that you can handle the problems in your life. But the thing that kind of really struck me was the idea of getting good at least a couple things. And, as I was thinking about that, I kind of reflected on how that kind of actually made a lot of sense even in my life. Because as an adolescent, as a teen, I was actually really good at sort of the academic side. Like I would always get the decent grades and, do well. And people would be like, oh, Parker, you want to be my group partner because, they knew I would do reasonably good work. But once I got into university, that's when kind of like the general wave of mediocrity hit, where I started getting kind of like, C pluses and Bs. Like I wasn't a particularly good student anymore. And my self esteem really tanked because I only had my eggs in like I only had one egg in a basket. I was like, academics was really the only thing kind of keeping my self esteem afloat. And once I started not really doing really well in academics anymore, then everything kind of fell by the wayside and I felt really bad about myself. So these days, I've really tried my best to kind of diversify a little bit in terms of the things I feel a little bit more competent in, like, in my academics, my clinical work with patients, with, writing, with presenting, with doing things associated with fitness and, working out at the gym. All of those things allow me to kind of diversify my eggs into many different baskets such that if I do get negative feedback on one side, I can at least kind of run to the other one and say, oh, like at least I'm still doing all right in these areas. And that bolsters me enough to not kind of feel really crappy about it and allow me to continue doing the things I know are right for me. Because if I feel like ashamed and feel depressed, that's going to be not very conducive to continuing to do the things I know are good for me. A second recommendation is to avoid avoiding. So, unsurprisingly, when we think about things like social situations or other things that we're afraid of, we tend to think about avoiding these situations as much as we can. Like, we don't want to go to that party or talk to that person because we're afraid of what might happen. And although this is really helpful for reducing anxiety in the short term, it then creates a lot of maintained anxiety in the long term because our brain never gets to really have a chance to learn that this situation isn't as scary as I thought, or for us to build up these skills and the competence to be able to feel confident in these different situations. So, to avoid avoiding, one thing that I encourage you to do is to go out and do the things that you know scare you. And I know this sounds really cliche, but this can be done in a very gradual manner. And it is a really evidence based effective treatment known as, exposure therapy. So, you can start off small by maybe just having an interaction with your Uber driver or saying hello to the person in the elevator and having casual chit chat or saying hi to the cashier and making small talk, all the way up to maybe asking the person you really like out. Whatever feels like a good sort of continued progression for you, that can be the right path to make sure that you're not avoiding in sneaky ways so that, maybe you're going too big too quick and you're having that interaction with someone that you're really afraid of. And then you're starting to avoid by maybe looking away or trying to end the conversation as quickly as possible. All of those things, even though you're technically facing the situation, you're not facing it by kind of subtly avoiding certain things that you're afraid of. Maybe you're afraid of that they're going to be frowning at you and they're not going to want to talk to you. So you're looking away, you're trying to avoid that possible consequence, or you're trying to get out of the conversation, or you're using alcohol to down the anxiety. All of those things are known as safety behaviors, which subtly help us avoid our feared outcome, but then therefore maintain the anxiety in the long run. So, kind of related to the competence breeding confidence, as you continue practicing in social situations, there are certain minute skills that allow you to feel more confident in these social situations. So, learning to kind of make eye contact. One of the strategies I often heard is to maintain eye contact long enough that you know what color their eyes are before you maybe take a bit of a pause, because obviously you don't want to be like staring holes into the other person. Or you might kind of learn to have more natural patience with pauses, being comfortable just sitting like that for a moment without saying anything. It can be asking the person question, getting the person interested, or when you're introducing yourself, offering a few different avenues of topics where you might say, oh, I came from Canada, went to graduate school here, worked my job here. That just gives people more opportunities to kind of go into different places and have conversations with you. So all of these things can be small things that you can tinker with and practice as you're engaging with conversations with other people. And some of the specific skills I find quite helpful for social situations would be asking open-ended questions about their field of interest. So things like, what was it like to live in, X city or X country? Or, how was this particular job for you? Was it like consistent with the things that you wanted to do? What are your kind of hopes and dreams? All of those things really just showcase that you are interested in the other person, and it allows them to kind of talk about the things that really matter to them. And one way to really showcase to the other person that you understand them and that they are being heard is through active listening approaches. And some of these skills come from, counseling and therapy, where you're actually providing information and saying things to showcase that you understand. Like, for example, you might reflect on their experience and say, that must have been really hard, or you must have felt really disappointed. And that helps them get to the core of the sort of the emotional experience. It could be summarizing some of the things they say or reflecting on what they said of like, oh, it sounds like, the things that you really enjoy are the things that are creative in nature and allows you a sort of freedom. Again, it kind of showcases that you really understand them above and beyond the sort of very superficial level. And one strategy I found really helpful with patients is to actually video record conversations that they were having. And this is kind of scary and sounds surprising, but one thing that people kind of note as they're watching their own recording, a couple of things happen. One, it allows them to build up the skills that they feel like they can shore up. Like, oh, maybe I was speaking a little bit too quickly. I wasn't giving enough pauses. I was focused a bit too much on myself and not asking enough questions, or vice versa. So those are all things that they can improve. But the other thing, surprisingly, is that the sort of more gentle, compassionate side kind of came out, and they were like, oh, you know what? Actually, I was, a little bit more funny than I thought I was, or I was a little bit more natural in the way that I was kind of moving, or I was a little bit awkward at first, but then once I got into the conversation, I started to kind of like loosen up a little bit. So all of those things then provide more evidence to suggest and give you a more accurate representation of what you actually seem like in those conversations, rather than letting your mind run rampant about how you think you're performing. Another strategy to feel a bit more confident is to accept the consequences of the conversation. And it sounds a little bit weird, but sometimes when we throw ourselves into a conversation, sometimes we are going to be awkward. The other person might not like us. We might stutter around a little bit, and we might actually have to end up in a slightly longer conversation. Like if you just wanted to say hi to the Uber driver, maybe they start talking about their life story, and you kind of have to accept that the conversation is going to be a little bit longer. All of those things are things that we have to kind of accept based off of our overall goals. If my goal is to have more of these conversations, then I have to accept that some discomfort comes with it, some awkward growth is going to come with it, and to be able to say, you know what? That's okay, because that's consistent with what I want to be doing, and I'm just going to go through it with a smile. And remember, the person in front of you is just like you and me. They also want to feel heard. They want to feel connected. They want to have conversations. And maybe they are also a little bit worried, a little bit shy, and worried to kind of open up. And taking that first step forward might allow that other person to feel connected and be happy to kind of have a conversation with somebody who does care, who does want to understand, and who does want to connect. So just remember that even though it kind of sometimes feel like we're all alone and we have the sort of a unique circumstance that makes so that it's impossible for people to understand, that there's a lot more human connection and commonalities than we might think, and you'll never know unless you take that first step forward.